like to introduce Freda from England, who takes LDN for ME. Thank you for joining me today.
Hello, Freda. Thanks for calling.
Could you
What
tell
can
me...
I tell you about my complex clinical history?
Okay. Would you like to tell your story?
Yes, you mentioned I have or had ME. This was diagnosed about 25 years ago when I went down with so-called glandular fever and mononucleosis. They didn't find the cause of it, except I had apparently 2 unknown viruses in my blood. And I was okay for a couple of weeks and returned to work. I was a full-time academic, and then I became ill again, and this pattern went on for about 6 months when I had to give up work, and by then I was pretty crippled. On reflection now, several years later, and the wisdom of several years later, I realized I had already, before I went down with the glandular fever, some symptoms of what I would describe as immune dysfunction, such as irritable bowel problems and psoriasis. Even at one stage having some psoriatic arthropy diagnosed, which then magically disappeared without treatment. I also, before I went down with the ME, several years before, had a lesion on my foot. Very bad, and I think it might have been a Lyme's tick, but I'll come on to that in a moment. I also had childhood migraines. They may or may not have been related to the fact that I had a head injury as a child. And my health has fluctuated a lot since the glandular fever, and I was unable to work full time. When I could, I eventually got back to working part time. I'm inclined to say on reflection it's a picture of chronic infection and probably chemical sensitivity, with these fluctuating symptoms of fatigue and migraine and feeling flu-like and rather toxic. Anyway, eventually chronic Lyme's disease was diagnosed in a rather unofficial way using live blood analysis, if you're familiar with it. And former blood tests didn't show that, but a blood test did show I had Babesia, which is a co-infection which goes along with the Lyme's tick. And I think that earlier foot lesion that I mentioned was actually probably when I was first bitten by Lyme's tick. I used to be a sportswoman, and I did a lot of mountaineering, for example, in places like Scotland. And in those days, you walked in the heather in your shorts. Nobody seemed to be particularly interested in warning us about Lyme's, but now people are much more conscious of it, thank goodness. At the time that the doctor diagnosed the Lyme's using this live blood analysis, he also suspected chlamydia pneumoniae, which was showing on the live blood analysis. A blood test came back as ambivalent, and I said, shall I have it redone? And the doctor said, no, my patients, when they show this, their blood test usually comes back positive. Very recently, I've had this now officially confirmed by blood tests that I have chronic chlamydia pneumoniae. So I think it's a picture of chronic infection, as I said. These stealth-like pathogens, they go under glorious names like intracellular, obligate, cell wall deficient bacteria, and so on. Perhaps some opportunistic viruses, and I suspect also a possible genetic and even possible familial connection. In respect to the latter, my mother had severe rheumatoid arthritis, for example. Perhaps we'll have a chance to just talk a little bit about the genetics in a moment. You probably want to know when I was prescribed Low Dose Naltrexone, and I was prescribed by the doctor who diagnosed the lines using the live blood analysis in about mid-2009, so it's about 3 years ago. And I took the low-dose naltrexone, working up to the target of 4.5 milliliters for about 1.5 to 2 years, as part of a combined treatment using different antibiotics and so on. The doctor concerned had several patients he claimed were benefiting from the low-dose naltrexone. And indeed I got much better, and I stopped all these treatments. Whether this was unwise and premature, I don't know, but I suspect it probably was. How much of this combined treatment was due to the low-dose naltrexone, it's impossible for me to say, except that my sleep certainly improved, and I think that could have been down to, particularly to the naltrexone. Anyway, the 2 last winters I had 2 bad winters with recurrent chest infections, feeling flu-like, and I also had an infected cyst on the chest wall, which was analysed and came back as mixed anaerobic bacteria. And so at that point I started to get quite a bad relapse. And so I resumed low-dose naltrexone on a low dose, and I want to eventually be able to reach the target of 4.5 milliliters. So, just to summarize, I suspect it's rather like epigenetics, this new field that everybody's talking about. I suspect there are these environmental factors such as the stealth pathogens and probably chemicals. I suspect genetic susceptibility with a particular reference to the immune system, and possibly a family connection. So, for example, I mentioned my mother's rheumatoid arthritis. How about that for some of my clinical history?
That's fine. Thank you very much.
Oh, and what I should...
And would you recommend LDN to other patients suffering with ME?
Well, now I've got to grips with the underlying theory and the increasing scientific evidence for it, for naltrexone, low-dose naltrexone for autoimmune diseases. And now I've read and heard a number of your testimonies on your website. I would certainly recommend it to those I think who are struggling with similar kinds of health problems. And especially given that conventional medicine, in my experience, and the National Health Service here in Britain offers very little to help people with autoimmune problems. I have paid for all my, shall we say, alternative treatments, and generally not been successful with GPs when talking about any. My latest one, for example, has said that that's research, until it's whatever ratified by NICE, the clinical excellence people, the authorities, big brother if you like, then it won't get prescribed by my GP. To be fair, I haven't actually asked for low-dose naltrexone from my current GP. I felt actually too discouraged to go any further, having talked about Lyme's with him, chronic Lyme's disease. As you know, it's not recognised officially by mainstream medicine in this country as an authentic condition. Maybe I should tackle him again. Does that help?
Yes, thank you.